So just as a heads up for everyone, I will be briefly mentioning suicide. So if you're not comfortable with that, you can just turn the volume down to 0 until I'm done speaking. But yeah, so I'm going to be talking about my own experience seeking puberty blockers and hormones as a young person. So when I was 13 years old, I was referred to GIDS. In case you don't know, GIDS is the Gender Identity Development Service, which is the gender clinic in London that all young people are referred to in the UK. And the GP told me that the wait time was 18 months. I received my first appointment at 16 years old. The GP refused to prescribe bridging hormones or puberty blockers, and puberty can finish in that amount of time. I could have gone through irreversible traumatic changes to my body, which would have been entirely avoidable. And the price of puberty blockers is around £250 per vial. So the defunding of the NHS is one of the reasons why GPs are so opposed to bridging prescriptions of blockers. So in order to fight for trans liberation, we also have to fight against the increasing privatization of the NHS. The Tories' defunding of the NHS has a blood cost. People die on that waiting list. People are assaulted for being read as visibly trans. People hurt themselves due to dysphoria, which the NHS does not have the funding to treat. And when I was 13, I looked into black market testosterone because testosterone is a controlled substance, so I can't buy it over the counter, unlike estrogen. Denying children access to hormones does not prevent them from taking hormones. All it means is that they get it from an unsafe source rather than prescribed by a doctor. And because of my distress at continuing to go through a puberty that I knew I shouldn't be going through, I was told to reach out to Mermaids, the charity for trans children in the UK, and I contacted them. I told them about my distress, about the lack of puberty blockers, and how I felt that the clock was ticking. And you know what they told me? They just told me that they couldn't help with medical intervention. This just points to the incompetence of the current state of trans activism in the UK. They're focused on liberal lip service of repeating trans women are women, trans men are men, non-binary people are valid, without fighting for anything that materially helps. They simply reiterate that puberty blockers are reversible, but they won't fight for our agency to consent to irreversible changes too. When I was 13, I was watching my cis male friends start puberty and go through irreversible changes. Why were they allowed to go through those irreversible changes, but I couldn't go through the same irreversible changes? So this is when I reached out to Gender GP, which is a transgender clinic started by Dr. Helen Weberly and Dr. Mike Weberly to provide informed consent hormones to patients. I was 13 years old, I was desperate, and I felt that the clock was ticking with regards to permanent damage from endogenous hormones. And it only took me a few months to access life-saving healthcare. I received puberty blockers at 14. I was supposed to wait a few more months before receiving testosterone due to restrictions imposed upon Gender GP, but they saw how much distress I was in due to not experiencing puberty alongside my peers and gave testosterone to me after only a month of blockers. This literally saved my life. I don't know if I'd be here today had I not received testosterone at 14, which the NHS was unable to give me. So at 16 years old, I finally received my first appointment from the Gender Identity Development Service. Their policy at the time was that you can receive blockers at TANA stage 2, and they can give you hormone replacement therapy at 16 after a year of blockers. For those who don't know, the TANA system is basically a system of categorizing what stage of puberty you're in. And TANA stage 2 is the first stage of puberty, so after puberty starts. So they don't even give you puberty blockers until after puberty has started. And the policy for not providing hormones until you're 16 is ridiculous, because after puberty has started, the detransition rate is, by a margin of error, 0. It is a statistically safer science. Says they are transgender, that they will never detransition. The scientific literature shows that adolescents basically never regret hormone replacement therapy or surgery, which is the same rate of regret as adults. I don't have the time to go through the studies right now, but I will post links in chat of some studies that demonstrate this. And GIDS refused to carry over my testosterone prescription from the private Gender GP. And the NHS policy is supposed to be they cannot ask you to go off of hormones that you started privately, but I was asked to go off of testosterone so that they could assess me and prescribe me puberty blockers. I would have had to stay on just blockers, no testosterone, for a whole year after that before receiving testosterone. And of course, I refused to stop taking testosterone because that would mean that my periods would return. This could put me in physical danger as I used the men's toilets, where it would not be safe to have a period or change pads. And the GIDS process is bureaucratic and opposed to the patient. There was no logical reason why I should have been denied testosterone, since I would have been eligible for NHS testosterone by their own policies. I obviously needed testosterone, and I had a gender dysphoria diagnosis from the NHS, but their reasoning was, it's not fair to fast-track patients who have gone private. What, so you should just punish patients for going private instead of making it freely available to everyone? I was not offered any physical help from GIDS, and instead I was just put onto the waiting list for an adult clinic and dismissed. And ever since I was 10, I've wanted top surgery. For those who don't know, that's surgery to remove the breasts. And I have the option to get top surgery at 16 or 17 years old with some private top surgeons. However, you need a private referral letter, which costs £150. And the surgery itself costs upwards of £6,000, which was way out of my budget. So I will have to wait until the adult clinic gives me my first appointment. From there, I'll need to go through an assessment, which will likely last several months before receiving a referral letter. After that, the wait time is likely 2 or 3 years until I can actually receive surgery. So to resolve dysphoria that I've had since I was 10 years old, I'll probably have to wait until I'm 20 or even later. That is completely unacceptable. Refusing to provide surgery referrals to adolescents is ridiculous. Those who are against providing healthcare for children make the point that surgery is permanent, but there's something far more permanent than surgery, which afflicts young trans people at an unconscionably high rate. That thing is suicide, and transgender children who commit suicide did not kill themselves. They were murdered. They were murdered by a government that wants to privatize the NHS instead of giving them healthcare, that would rather see them die from debilitating dysphoria instead of recognizing the scientific consensus and paying for their treatment. We can link this to Friedrich Engels' idea of social murder. Social murder is where the bourgeoisie places proletarians in a position where they inevitably meet a too early and unnatural death. Social murder is a disguised murder. Nobody sees the murderer, and the death of the victim seems natural rather than imposed. It's a murder of omission rather than commission. And I never had to fight against Gender GP. Gender GP worked with me, not against me. I had to fight the bureaucracy of GIDS. GIDS was testing me, not trying to help me. Now, I've been the target of transphobic bullying, which was unpleasant, but I could handle it because they were my peers and my equals. They had no institutional power over me. The real struggle in my life has been against medical professionals who deny my bodily agency and against a government that is happy to let me die. And all of this points towards the case for an informed consent model. So in NHS gender identity clinics, they work on an assessment model, which is where you go in, they'll want to assess you, look at your childhood, look at your personal life, and then give you a gender dysphoria diagnosis. And this can take several months, maybe even up to a year or longer. And then they can finally, after your diagnosis, they can start prescribing you hormones or referring you to surgeries. This assessment model is invasive, humiliating. It tests you instead of working with you. And it's stressful, especially when the clock is ticking and you're going through puberty that you know you shouldn't be going through. You have to jump through hoops and fight the bureaucracy of the gender clinic. The alternative to this is an informed consent model, which is basically where you request hormones or surgery or whatever it is you need. And what the clinic will want to know is that A, you are capable of consenting to the treatment you're asking for, and B, that you understand the treatment that you're consenting to. And this is already in place in some places, like in the United States, there's Planned Parenthood. You can walk into a Planned Parenthood clinic, ask for hormones, they make you sign a form, make sure that you understand what hormones are, and then you can receive a prescription. In the UK, we have Gender GP, and after contacting Gender GP for the first time, you can usually receive hormones after 1 or 2 months. And all of this points towards the necessity of funding the NHS so that we can afford informed consent in the first place. We have to reduce the unacceptable waiting times. We have to give the NHS the ability to pay for hormones and surgery for everyone who needs it. It doesn't have to be like this. We have the power to change this. Every right we enjoy is the result of working class struggle, and it is working class struggle and trans resistance that will set us free. Thank you.